Hello people, thank you for joining us today on the program Healthy Living. I'm Adesuwa Osa Uwage. As a man, do you really know when you're having problems with your body? How would you even know that something is going wrong, particularly when there are no signs and symptoms? Have you ever gone to the hospital to do a full medical check on yourself as a man and as a human being? If no, then you have quite a lot on your plate. And I wonder if you can finish everything that you have on your plate medically. In this part of the world, it's very difficult for people to just walk up into the hospital to say, okay, I want to do some checkup. Very hard. It is only when there is an emergency that people will rush to the hospital. Most times it's usually emergency case, emergency case, emergency case. And we do not want you to be one of those persons. Look around the world, a lot of men are coming down with what we call prostate cancer. Yeah, I usually twist my tongue when I'm calling that, okay? And some don't even know what to do about it. We've heard that a lot of persons go herbal way. Would herbal medicine actually cure this condition or not? These are many more we're going to be looking at today on the program Healthy Living. And joining me to do this is a medical practitioner. He's a general medical practitioner and of course an author, and he's quite vast in what we're going to talk about today. Please join me to make welcome Dr. Austin Eigbochie. I hope I got that right.
Yes,
I should get that right.
You got that right.
It's a pleasure to have you join us on the program today.
Thank you very much.
All right, when we're talking about prostate cancer, exactly what are we looking at?
Okay, prostate cancer, the term cancer is very popular. It's not new.
It is.
The layman on the streets has heard that term, but possibly does not know what a cancer is. Yes. So if you were to tell us what prostate cancer is, I may have to talk about the two terms, the two components, prostate and then the cancer. A cancer is an abnormal growth. It's an abnormal growth is a condition, is a disease condition where cells begin to multiply abnormally in a certain region of the body. But that's not all. These abnormal cells do not stop at multiplying, but go ahead to spread to other parts of the body where they could cause problems. So that spread is what makes it a cancer, as a matter of fact. Then the prostate itself is a small organ that occurs in males only. So it means that the average woman has no major business with today's discussion because they don't have prostates.
Yes, that's why I directed
exactly.
to the male folks.
Very true. But they could listen to and help their husbands for those whose husbands are not at home, yes. So it's a small organ found in the male. It's part of the male reproductive system. It's about the size of a walnut. Yes, that may require me speaking some medical jargons. But okay, there's what we call the urethra, which brings urine out of a male. Now, somewhere along the length of that urethra, around the beginning of the urethra, that's where you have that walnut-sized organ wrapping around the urethra like this. So it's a very small organ. That organ produces fluid, what we call prostatic fluid, because normally when a man ejaculates, what comes out of the man is called semen. This semen contains the sperm cells that would eventually bring about children, and then the fluid that will nourish the cells as well as propel them, move them. So that fluid, the prostate contributes part of it. So we say it produces part of the seminal fluid. So the cancer we talked about before, abnormal proliferation of cells, imagine it occurring in this organ we just talked about now, the prostate. Then we have what we call prostate cancer. So in prostate cancer, there's an abnormal replication, abnormal growth of cells, plenty cells in that prostate, leading to the prostate becoming enlarged in size, as well as those abnormal cells leaving the prostate to go out to other organs. In medicine, we call that metastasis. We say it has metastasized. It has gone to other organs of the body. And like I said, that could cause serious problems in those organs.
Okay, thank you.
So that's what prostate cancer is.
Okay, now let's look at the cause or causes of prostate cancer.
Okay. Well,
What
there
are the
could
things
be
that could cause it?
there could be different things that people list as causes, but first we must understand that prostate cancer is a cancer, as the name implies. And what causes cancers generally? Cancers are usually as a result of what we call mutations. Now we'll be doing a little bit of science here, because within us there are many cells.
Yes.
Now within these cells there is an information molecule called DNA. This DNA is what instructs the cell on what to do. If a cell is to do A or do B, DNA tells the cell to do so. And even when it comes to replication, it is DNA that tells the cell when and how to replicate. But if an abnormality occurs in this DNA, maybe where, like they say in everyday terms, when one screw is missing, good. If a part of this DNA is missing, or something is replaced by another, any kind of abnormality in the DNA could mean that it begins to pass wrong instructions to the cell, so that the cell could begin to replicate at a very high rate. In that case, we say that mutations, changes in DNA, are the main things that cause cancers, and prostate cancer is not left out. It is mainly due to these mutations. So mutations cause cancers generally, including prostate cancer.
All right, to the layman who, because I know that a lot of persons watch this program, to that layman who do not understand what you mean by mutation, how can we explain it to that person?
To the layman, I would rather say that these mutations, since he does not know what a mutation is, and we do not exactly have substitute terms, so we could just let them know that within your body there are cells. These cells contain some molecules, so at times these molecules could experience some changes in form. We pick some objects within the room there and show them, if this thing becomes like this, do you agree to not work well? He says yes. So we let him know there could be those changes. But we'll also point out to them that while we have mutations as the cause, we also have risk factors. Yes, talking about risk factors. First, it is not every person, every man alive today that will come down with prostate cancer in the end. Some men will live many years and not come down with it. So first thing we must understand is genetics has a role to play. For example, if I have a first relative, such as a father or a brother, who had prostate cancer, then it means I am a likely candidate for prostate cancer. That's where genetics comes in. So that is not really, we don't call it a cause now, but a risk factor. Then people who have habits like smoking, whether first degree or second degree, like they say, second-hand smoking. Like you may not be smoking, the passive smokers, exactly. So I am smoking, but you are nearby inhaling. You are also likely to, because in this cigarette, there's, the tobacco. Tobacco itself could be a carcinogen, it could be a mutagen, it could cause mutation. So all these things that we take in, even radiations, sunlight, ultraviolet radiation, which is sunlight, and then also radiations, those who work in labs, x-rays and the rest, all these radiations are powerful and they could cause those mutations. So ultimately, mutations cause cancer, but there are mutagens, the main substances that could cause the mutations themselves. So in all the sources of mutagens, we regard them as risk factors for prostate cancer.
Okay, so you've talked about tobacco.
Yes.
What about alcohol and maybe some kind of food? You've also talked about things that we can get from the environment, like radiation and all of that.
Yes.
What are other things that could,
Okay. So alcohol, yes, maybe to some extent, alcohol is also there. Then foods, of course, there are several foods that we eat that could predispose to it, even though we don't have established studies on some of them. But what we tend to do more is educate people on what kind of food to eat. You understand? What kind of food to eat. We know that grains, nuts, vegetables are generally good diet because they seem to contain less of these carcinogens or mutagens, as it were. But things like processed meat, we consume that a lot. They are very good sources of mutagens or carcinogens. Then we also have some canned foods, fruit juices. Well, plenty studies suggest that these guys could be real sources of mutagens. You understand? So those ones are there, but we talk more about the kind of foods that people, especially at a particular age, should consume more so that they can stay healthy. But remember, irrespective of food, irrespective of habits, if there's the genetic factor in it, then there's very little you can do to stay away from prostate cancer.
Okay, well, when you were talking about the risk factors, you did mention that if you have somebody in the family that has had it, it's possible. So can we comfortably say that it is hereditary?
No, we can't say it's hereditary. We can't just say so. But like I said, the term we use is there's the genetic predilection or genetic preponderance. So there's the genetic link in that. We've noticed that for many cancers, once a first degree relative has it, then there's a high chance, because we cannot talk about the fashion in which it is transmitted, for example. I can't say, okay, if a father has it, 10% of his daughters could have, and so on. We just talk about the role of chance, you know, looking at statistics, looking at, like, if a patient comes to the hospital now and has prostate cancer, part of the questions I'll ask this patient is, did your father have it? Did your brother have it? So from the response they give to us, we tend to put together all the information we have acquired from patients around the world, and we're able to say, well, studies have shown, or values have shown, that many of these persons that have prostate cancer now had relatives who had the same condition.
Wow.
Yes.
That's huge. Now, we'll talk about cancer. You just said that there's a swelling somewhere, you know.
Yes.
And then there is something called tumor. Some persons will say cancer.
Yes, tumor.
Are they one and same?
Okay, there's a thin dividing line. As a matter of fact, cancers are tumors. Yes. I can say every cancer is a tumor, but not every tumor is a cancer. Yes. In that a tumor is a swelling, to begin with, a swelling in any part of the body without inflammatory components. However, this swelling that is due to abnormal growth or multiplication of cells, one important question that arises is, does it spread, or does it get to spread to other organs, or remains within the affected organ? In the case of tumors that do not spread, that is swellings that do not spread, swellings where the abnormal cells do not go outside the affected organ, we use a term, we say that tumor is benign. That's how we describe it. But in a case where you have a tumor within an organ and the cells tend to migrate, they go out, they spread, we say that tumor is no longer benign, it is malignant. So the malignant tumors are the cancers. So cancers are the malignant type of tumors, not the benign. Like this prostate cancer we're talking about, there's a similar condition to it. We call it benign prostatic hyperplasia, BPH. So some men, you could see two men that have enlarged prostates, but while one of them has a benign enlargement that does not spread out, the other one has a metastatic one, a malignant one. That person has a prostate cancer, not BPH. So the managements will be different, the presentations may be similar but different. So many things about them are different. The outcome, the prognosis, how this person, the quality of life they enjoy will also be different. So benign, like I said, they don't spread, but malignants would spread.
Wow, that's interesting. Now, some persons may want to know the signs and symptoms, because a lot of times we refer from literatures, from what people say, from what you medical practitioners say, you say there are no signs, there are no symptoms. But we want to know, what should a man look out for?
Okay.
What are the telltale signs that should propel the man to go to the hospital?
Okay. Unfortunately, for prostate cancer, telltale signs are hardly ever present. Yeah, in most instances they are absent. So what a man could do is, one, like I said, think about genetics, think about your relatives. Do I have a relative who had this condition? If yes,
like this relative we're talking about now. What
yeah, like I said, first degree, father, brother. But at the same time, it could also be from, second degree relatives, maybe even from grandparents. We consider all of them, you understand? So all of them are considered. But whereby they tell us nobody in their lineage ever had that, it doesn't mean they cannot start it. They still could be the first. But where they tell us they have such relatives, then it makes us more interested in their case. So as a person, one thing you should think of first is, do I have anyone that suffered this condition? If yes, it means I should be preparing to see the doctor even when there are no signs. Because for a truth, there are hardly any signs. That's the sad thing about prostate cancer. Most cases are asymptomatic. So the man, one, needs to know how his family line is, and then two, age. Whether you have relatives, yes, whether you have relatives or not. Once a man, the cutoff for in many climes is 55. Okay. A man who is 55 and above is instructed or is required to see his doctor routinely.
Does
go and see.
Younger cannot come down with it?
Yes, I was coming to that. So 55 is the cutoff. But for a person who has relatives that has that condition, it is advisable to go at an earlier age of about 40. So 40 to 54 can start screening already.
Okay.
But for a person who does not have relatives, generally 55 is fair enough. But I could choose to, at the age of 50, walk up to the doctor for screening, and that will still be in order.
How is the screening like? It's usually
okay, the screening, I would come to the details of it. I'll talk about the screening. Let me just finish up with symptoms. So like I said, it means asymptomatic, but you walk to the hospital, the doctor checks, and then in most instances, he is able to establish a diagnosis. So the screening done, like you asked, first thing that we do, in fact, there are three components to it to reach a diagnosis. The first one is digital rectal examination, where the doctor, with a gloved finger, inserts his hand into the anus of the patient. It can be very discomforting, it can be disgusting to the patient too, but of course for health's sake he shows understanding. The doctor goes in with that gloved finger and then tries to examine the prostate, because where the prostate is located, this gland we're talking about, is such that you can access it from the anus. Okay. So when the doctor goes into the anus, he tries to feel the prostate. At that point, he's looking for certain things. He's checking the texture of the prostate. He's trying to see the size. Has it increased? Has the texture changed? He's trying to see there's a line. We call it the lateral sulcus. He's trying to see whether it is obliterated, or he can still, palpate it, feel it with his hand. He's trying to check for nodules. He's checking many things. Now, if he sees that all of these telltale signs are absent, it doesn't mean there's no prostate cancer. That's just a check. At the same time, those telltale signs may be there, but there's still no cancer, which is why there's a second stage now, a second thing he does, which is like the more common thing we do. We call it PSA measurement. Okay. PSA stands for prostate specific antigen. PSA? Yes, PSA. Now this PSA, it is, for example, there are some things we call markers. There are some things you see, and they indicate the presence of another thing. Okay. You understand? I may not see a fire near me, but when I feel sudden extreme heat, I know that there's a source of that heat around, something like that. Good. So this PSA, it measures a certain, the antigen itself is measured by a test, what we call the PSA analysis or PSA test. And when you carry out this PSA measurement, you are looking at the levels, because ideally, prostate-specific antigen is supposed to be low in an individual. But when the levels begin to rise, you begin to suspect cancer. In some climes, the cutoff is 3 nanograms per mil. Once they cross 3 nanograms, they begin to suspect cancer. Some other climates, most places, they look at 4. Once it reaches 4 nanograms per mil and above, you suspect cancer. But the interesting thing is, after you see 4 nanograms, which is cut off, you go for a definitive test, the one that can confirm that there's prostate cancer. We call it a biopsy. So you go to that prostate and take a pinch. That pinch of the prostate you are taking, you look at it under the microscope. So there we can see whether the cells are normal cells or abnormal cells. It's only then that we can establish that there is a cancer. Biopsy. So DRE, digital rectal examination, may give you a hint. PSA measurements may give you a hint. But what confirms whether there's a cancer or not is that biopsy. But sadly, biopsies can be characterized by many false negatives. We call them false negatives. As per, a person could have the cancer, you do the biopsy, view under the microscope, and you don't see anything. It's possible. In that case, we say there's a false negative. So in that case, we tend to tell the patients to return routinely for biopsies. We have serial biopsies with them, so that along the line you may catch the cancer. In some people, even though we talk about cutoff of 4 nanograms per mil, some people come to the hospital with 1 nanogram per mil, which is not supposed to be suggestive of cancer, but you do a biopsy and you catch the cancer. Some others come with 6 nanogram per mil. You see it now, 6 nanogram has gone beyond cutoff. You do a biopsy and there's nothing there. Again, continuous biopsy. So you do serial biopsies over a long period. But that's how diagnosis comes about. We make a diagnosis, rectal examination, PSA measurements, and then a biopsy finally.
Now, let's look at data. Like how many men have this problem?
Let's
look at our country, Nigeria.
Well, it's quite common amongst us, but it's not as common in our own environment as it is in some other places like the US. Interestingly, they seem to have greater figures than us. Like there, they'll tell you that prostate cancer is the second commonest cancer beyond lung cancer. It's just about the same in us. Lung cancer, yes, remains number 1, then prostate cancer. Okay, in their case, prostate cancer is the commonest, actually, in males. Yes, male cancers is the commonest, but here we say it is second commonest. So it actually affects a large number of men. It is very, very common. I don't have exact figures to give, like, okay, in 2020, see what the value was and so on. But yes, it is very common. And sadly, many of these cases are missed because of our bad health-seeking behavior. I like how you started the program telling people to go to the hospital, submit yourself to the doctor. You understand? So you see people who just go about life, and of course, because it's asymptomatic, a man could be at 60, he's able to guard about, he doesn't know that things are going on within his prostate, only for him to, at some age, come down with the full-blown cancer. And when we check, what do we find? Oh, it has been there since, but you didn't come to check. You understand? So as a result, they present late, so the prognosis is quite bad within our environment, within our system. So
is it manageable? Is it treatable? Is it curable?
Yes, it is treatable. It is curable. But that again would depend on how early they present. Because for a person who presents very early, imagine a man of 55 who comes with the localized cancer that has not spread, cancer that has not gone advanced, because we can have the advanced form of it. So if you come with a localized or new case, no problems. The doctor could, apply different techniques. There's the conservative management, we have medical treatment, and then again, there's the option of surgery. In fact, I know of a person who walked up to the doctor and requested that the prostate be removed for fear of what could happen in the future. Just take it off. I've completed my family size. So if they present early, we have many options. There's hormone therapy. Yes, so we could carry out hormone therapy, give them certain hormones that are able to create a balance and try to slow down the process or halt it. Although that comes with its own side effects too, because people on hormone therapy could have problems like fractures, they could have decreased libido, they could have erectile dysfunction, they could have enlargement of the breasts. We understand different problems like that could occur in those ones. But that's not all. There's also the option of surgery. We call it prostatectomy. You could remove the prostate, especially in a man that's completed the family size. The prostate can be removed. That puts his mind to rest. Then beyond surgery, there's also, like I said, medical treatment, certain drugs that could be given. And then there's those that come late. We have those ones that come late that wait for many things, many symptoms. There's metastasis already. For those ones, yes, you could still offer them surgery. But what is more common is you begin to have radiotherapy, chemotherapy. Chemotherapy has to do with giving drugs, anti-cancer drugs. So you give anti-cancer drugs, and then for radiotherapy, you'd be using radiations. That's an interesting thing. Fela, in one of his songs, permit me to speak pidgin.
Please go ahead.
He said, if water kill your child, now water you go use. So the radiations that I mentioned at the initial point as one of the causes, possible causes or risk factors for these cancers, can also be used to treat the cancers. All right. So when you use these radiations, they're able to destroy cancerous cells. So that's also an option that is open. So what treatment we give, what experts it will require, because in some instances it's multidisciplinary. You could need the surgeon, you need the oncologist, you need the physician, you understand? So who it will involve, what it will take, how much you spend, how many years you have left, stuff like that. The prognosis is what I mean. All of that is dependent on the stage at which the person presents, which is why it is very essential, like you said at the beginning, that people who have reached a certain age, males especially, should see their doctors from time to time, so that issues like this one could be, prevented from getting out of hand. Yes.
The program is Healthy Living on ITV, and I've been talking with Dr. Austin A. Bochi, and we are talking prostate cancer. Our phone lines is opened. We've opened our line now. Is 052-290-573. It's going to be on your screen. Call. We're not expecting calls from only the males now. Female, call on behalf of your husband. You might. Is it possible for a wife to help the husband to know that there's something going on or going wrong with the man? Some men will say, some men have called in to say that, they were the one that discovered that their wives have breast lump and all of that. Is it possible for a woman to know?
Okay. In the case of the man discovering for the woman, it's possible because the breasts are outside and the man's hands could access them. But a woman would hardly have reason to stick her finger into her husband's anus. And even if she does so, she may not be able to interpret what she's feeling there. So there's hardly any room for that, except of course maybe in advanced disease, the woman could make suggestions as to the man going to see his doctor and so on.
All right, 052-290-573. Please call Dr. Austin. He's seated here already. When he leaves, I will not be able to answer questions, okay, on this issue because I'm not a medical doctor. I'm not permitted to give you answers. So 052-290-573 is the number to call to ask your questions. I know medical doctors don't like to hear herbal, but I've heard people say that, somebody had this, or their father or their brother or husband had issue with prostate cancer, and then they use herbs, particularly soursop. Yeah, that's what people say.
Okay.
Particularly soursop, the fruit, the leaves, they make tea out of the leaves and all of that. So what do you think? I know medical doctors don't like to talk about herbs, but does it help?
Okay, what do you think? So I'll say what I think.
Yes.
First, the truth is that the herbs that people take, according to evidence that abounds, in many instances, it truly helps. There are many people who derive benefits from herbs. Okay. So I'm not in a position to say herbs are never beneficial.
Okay.
But
let's quickly do this call. Hello, caller. Good afternoon. Hello. Hello. Please, when you call, we can't be doing this week in, week out. When you call, reduce the audio level on your television set so that we can hear you properly.
Hello, good afternoon.
Good afternoon.
I'm calling from Obia Southwest.
Happy to hear from you. What's the name, please?
My name is Faith.
Okay, go ahead, Faith.
Ma'am, please, I want to talk to the doctor.
Go ahead.
I'm feeling pain on my hand, on my left hand.
Okay. Okay, you know the problem now, madam. You know the problem now. If you check your television set, you will see the topic that we're discussing today. Okay? So ask questions based on the topic. I thought you were going to ask questions on behalf of your husband. Perhaps your husband is shy or don't want to talk on air. Okay. So 052-290-573. Please call us. And hello, good afternoon.
Good afternoon.
Please tell us your name and ask Dr. Austin a question.
I'm calling from Ekema Road. My name is Francis.
All right, Francis, go ahead.
I just want to know if this prostate cancer has any symptoms that a person can develop before going to the hospital.
Okay, that means you didn't start this program with us. All right, Austin wants to know if...
I didn't hear the question.
If there are any signs or symptoms that will propel one to go to the hospital?
Okay, we said that there are hardly any signs or symptoms. Instead, one has to go to the hospital. But in a case where the prostate has become enlarged, whether it eventually spreads or not, because like I described before, it is, binding or covering the urethra this way, it could block that urethra such that the person could have urinary symptoms. But urinary symptoms do not necessarily point to a cancer. When the person gets to the hospital, they could see a cancer or no cancer. So if a person has urinary symptoms like urgency, what is urgency? You stand up, you need to hurry to the toilet. That's urgency. There's hesitancy. You get to the toilet, you have to wait for a long time before you can initiate urination. Then we have frequency. A person with frequency is urinating every now and then, many times a day. We have nocturia, waking up at night, many times at night to go and wee. Those are urinary symptoms. Then there could also be poor stream or weak stream. A person with weak stream urinates and the urine doesn't flow. You see that it's sluggish in flow. Then there's also straining. Because there's that obstruction, a person with enlarged prostate strains himself to pass out urine. There could even be that feeling of retention, like you feel you've not finished emptying, even though you are done urinating and want to leave the toilet, which may cause them to go back sometimes. So all of these are urinary symptoms that may show up. But when the cancer itself has come, of course, there could still be the symptoms of those ones. Remember, it spreads to other organs. So there could be organ involvement for the lungs. You can have involvement with the liver. You can have involvement with bone. People complain of bone pains, pains around their lymph nodes and so on, weakness. Many cancers come with weight loss too. You understand? So all of those could come, but those are not just good symptoms. They are symptoms of advanced disease. So in the early stage, all you may see in the early stages will be those urinary symptoms I listed.
Okay, Francis, hope you're happy with that. 0522905573 is on your screen. Hello, caller. Do well to reduce the audio level on your TV. Hello. Hello.
Hello.
Good afternoon.
Hello.
Good afternoon.
Hello.
Hello, good afternoon.
Yeah, good afternoon.
Okay, what's your name, please, and where are you calling from?
Doctor is the one calling. I'm from
Okay, go ahead. Dr. Austin is listening.
Can I talk to Dr. Austin?
Yeah, he's here.
Please, the treatment for prostate cancer. Do we have the facilities in Benin here?
Okay.
Like you said, radiation, then
chemotherapy.
operation.
Okay.
Is it possible here?
Okay.
Go ahead.
Very possible. University of Benin Teaching Hospital is one place people run away from. They prefer to go to the chemists and so on. But I think for this your question, you seem to be someone that likes the hospital. So, like you have good health-seeking behavior. So yes, UBTH is one very open center. It's accessible. There are various private hospitals too that do the same. But I'm not here to, let me say, advertise the hospitals as it were. But UBTH is open to all. It's a federal government institution where they offer all of these services that I have listed. So if you know anyone with prostate cancer, UBTH will be an appropriate place to go to.
Okay.
The range of the prostate cancer, you stop at 4. But we have seen indication of 74, 100 plus and the other in the PSA test. What does this suggest?
Okay.
And step number 2, the hormone therapy issue, the side effect.
The side effect of the therapy?
It's not easy. Especially it leads to, they said, one has to have a risk of impotency. And that is a dangerous outcome.
Okay. I did not say that 4 is the maximum. I said 4 is a cutoff. And when I said 4 is a cutoff, what that means...
Please reduce the audio level on your television set, please.
So can you hear me now? Good. I didn't say 4 is the ceiling or top level. I'm saying that 4 is a cutoff as per when the level goes above 4. Then the doctor is wary, the doctor is concerned, he wants to do a biopsy. People can have crazy values, like really, really high values of 20, 50, 100. Yes, it's possible. All of those, like the higher the value, the greater the chances that there is a cancer there. That's the thing. So I'm not saying that 4 is the maximum. I said it's a cutoff. It's where we would want to do biopsy. If I check and I see 0.5, I may not want to cause you the discomfort that the biopsy brings. So I may not want to immediately, want to take tissue to the lab.
We're still on the program Healthy Living and discussing prostate cancer with Dr. Austin Egboche from the University of Benin Teaching Hospital. All right, moving on. Doctor, let me quickly ask you this question because we're pressed for time now. You can still call in anyway to 052-290573. How does prostate cancer affect sexual activity? Okay.
And before I answer, let me quickly correct. I'm not from the University of Benin Teaching Hospital.
Oh, sorry about that.
I was trained there. I'm from Jonas Medical Center.
Okay.
In town, yes.
Jonas Medical Center.
Yes.
Sorry about that.
Okay. So it could affect sexual activity. That's very true. First, like I mentioned before, it could lead to decreased libido. Okay. And of course, a man with decreased libido would not be very sexually active. It could lead to erectile dysfunction as well. So those are
Before
two major
or after
ways.
Surgery?
Okay, you're talking about the disease itself or surgery. After surgery, well, if erectile dysfunction has set in before surgery, it just may not be correctable. You understand? It just may not be reversed. Yes. But in a case where the disease is caught early, many of these things we mentioned may not show up eventually. Okay. But of course, another thing again is that this disease is occurring in elderly persons, as it were. And for many of them, sexual function reduces with age. Okay. So it may be the case that the person mistakes this loss of sexual function or attributes it to the disease, whereas it's just a normal finding with increasing age. So yes, the disease can cause all these attendant effects, but surgery itself is unlikely to be the cause of loss of sexual function, not at all. Instead, hormone therapy could, because we are trying to alter the hormones. Like yes, and these hormones could, of course, because they are related to sexual function, related to libido, related to maintenance of erection and all that. Because you've altered them, there could be those problems. But for surgery, no, not when it is carried out by, a qualified consultant in that area. Yes.
Okay, 052290573. Hello, caller. Good afternoon. Please. Good afternoon. Okay, you want doctor's contact. All right, we'll see about that. We'll see about that. If he wants his contact on air, we'll let you know. Okay, so apart from that, you're not asking any other question? All right, 052290573 is the number. The number is right there on your screen. Please note that if it does not have signs and symptoms like doctors said, you may not have pains, but you may have some telltale signs, which of course he already explained to you. But with or without those telltale signs, the moment you are 50 and above, if you ask me, 50 and above, I think you should go to the hospital to see a qualified doctor. Hello, caller. Good afternoon. Hello.
Hello.
Hello, good afternoon.
Yes. How can they prevent the word?
Do me a favor, reduce the audio level on your television set, please. Are we there now?
How can they prevent the word prostate cancer?
What do you want?
How can they prevent it?
Okay, we'll go to that, okay? The caller wants to know the preventive measures to take to avoid coming down with prostate cancer.
Okay. In terms of prevention, which of course is always better than cure, like they say, the first thing would be to check if you have a genetic link.
Okay.
Do you have any relatives? If yes, you should be serious about checking. And then second, beyond that, health-seeking behaviors. A person or a man who has reached a certain age, like we said, around 50, 55, should already be going to the hospital. That in itself is preventive. Go to the hospital so that if there's anything, it could be caught early and quickly attended to.
You don't necessarily have to be sick before you go to hospital.
And you know, it's related to the question you asked before about at what age do they die. If we catch it early, they may not die from the disease. But when it comes, you know, in the advanced stage, they could quickly deteriorate and move on. So that's number two. Then lifestyle. You have to avoid smoking, like we said before, whether first-hand or second-hand smoking. Alcohol, you could do away with it if possible, or cut down to approved levels. And then diets. We talked about diet earlier. We said you should feed more on vegetables, nuts, and you know, avoid processed meat, avoid processed foods because they could carry these carcinogens. And then exercise also. Regular exercise can help. For a person who is overweight, you may want to shed some of the weight, do exercise, and you know, that could also help. But the most important thing is know if you are a likely candidate in terms of checking your first degree relatives, and then second, whether they are there or not, see your doctor very regularly once you have attained the age of, you know, beyond 40, 50. See your doctor. But like I said, the cutoff for people without genetic, you know, preponderances, those ones would want to look at 55 as cutoff.
All right, for those who are already battling with prostate cancer, any hope for such a person? Yes,
there's hope. People who are battling with cancer, okay, there's what we call grading or staging of the cancer, because not all cancers have a caller.
Hello, caller. Good afternoon.
Good afternoon. Good afternoon.
Please tell us your name and ask your question.
Please, I'm Apostle John. I'm calling from Benin.
Okay, Apostle John.
Yeah, I want to ask, what can be the sign for someone to know that he's developing cancer?
Please ask that question again.
What can be the sign if somebody is developing cancer?
Okay, the signs.
Yeah.
Okay, you want to know the signs, the symptoms, if somebody is developing cancer. Okay, Dr. Austin, you want to give him that answer again?
The signs and symptoms for a person to know if he is developing cancers. Different cancers come with different signs and symptoms. But the cancer in focus is prostate cancer, and we have said that it usually is asymptomatic. You don't get to see symptoms. The only symptoms you may probably see would be symptoms that occur as a result of enlargement of the prostate itself, which I mentioned before. Urinary symptoms, you discover you're urinating too much, you discover you urinate much at night, you wake up very often at night to urinate, stuff like that. We listed them before. I may not need to go over them again. But those are the only symptoms you may see. Otherwise, for prostate cancer, it's usually asymptomatic. It is the doctor that you visit that would eventually check and discover if it's there or not by the same methods I have listed earlier.
All right, Doc, before we continue with management of prostate cancer with those who already have it, there's this question that came in via text. It said, the school of thought has this belief that a sexually active man can hardly develop prostate cancer. Is it that sex cures it?
Okay. The person said a school of thought. Sex does not necessarily prevents prostate cancer. That's not very true.
That's if a man is very active.
Sexually active, yes. A man whose first degree relatives, for example, have had the cancer cannot run away from reality just by being very highly sexually active. So sexual activity, yes, some schools of thought, some studies, some findings show that it's possible that men that are very sexually active may not have enlargement of the prostate. There's a difference between the prostate enlarging and there being a cancer. Because we said before that some persons could have an enlarged prostate and there's no cancer, that's BPH. So truly, some 1 or 2 studies here and there have shown that when there is an increased level of sexual activity in a man, it could reduce the chances of prostate issues. But it doesn't necessarily mean that once you're sexually active, prostate cancer will be far from you. Because it is not caused in the first place by lack of sex. So that's it.
So that school of thought is just on their own, so to speak. Okay, we're talking about management. So somebody who already has it, what's that person supposed to do?
Yeah, for a person who already has it, it's not something to be managed at home. See the doctor. The doctor looks at it. Like I said, we have grades or stages. We have the TNM staging. We have the Gleason grading system. All of these things, or they are tools that we have to help us see the extent of this cancer, to see how far it has gone. And the intervention that will follow depends on the stage at which we catch it. So the stage where we catch it determines, 1, what we do, and 2, what the outcome will be like. That's the thing. So management is possible. Any person that has prostate cancer, submit yourself to the doctor for evaluation. Yes. Well, for those who would want to reach me, I am on my number now.
Okay, let me quickly call a number that they can do a follow-up on, okay? For those who want to do a follow-up on this topic, please call 080-3310-7361, 080-3310-7361. That's the number to call to do a follow-up on this topic we've just discussed, prostate cancer, and it happens only in men. Women don't have business with this kind of cancer. All right, doctor, as our parting words to those who have been watching us for the past 1 hour.
Yes, I would say thank you to them for watching, and it is our hope that the things we have heard will not leave us very quickly, like the males especially that have listened to us. Check yourself, check your age, look around you, your first-degree relatives. Is there any of them that has the condition? You may want to, like I said, present before your doctor, especially if you've come of age, you've reached 50, you're around 55, see your doctor. Let him examine you. Let him do the 1 or 2 necessary tests, and based on the outcome of this test, he could tell you what to do. And then also you must avoid this belief that when you take yourself to the doctor for check, then you do not wish yourself well. Not necessarily. Go and check, because even right in your house, if the cancer is in you, it's in you. So go to the doctor. If it can be caught early, then you'd be among those who would tell people about your cancer story. You tell them how you once had the cancer but defeated it. So those we see who defeated cancer, in many cases, they presented early. So yes, cancer is an enemy, but it's a defeatable one.
All right, Doc, before I let you go, this text message just came in and said, can phone radiation cause prostate cancer or any other cancer for that matter? Phone radiation.
The answer to that is yes. Radiations are radiations. So phone radiations, yes, there are some very few radiations that are less harmful. But phone radiations, yes, it's possible that prolonged exposure to them could lead to cancers. It's possible. They could cause mutations. Anything that causes a mutation can lead to a cancer.
Thank you very much, Dr. Austin Egboche, for finding time to be with us on the program today. I hope you've had quite a wonderful time with us, particularly our brothers, our fathers, our uncles, our nephews out there. Do something for yourself today. Dr. Austin just said that prostate cancer can be defeated if only you present early. Let us have this healthy attitude to, visiting the hospitals from time to time to do checks, and of course to save ourselves a lot of trouble. We'll see you again on Monday. Bye-bye.